Good afternoon, Miss Weasley. My name's Katie, and I'm going to be your nurse today.
Nice to meet you.
Can you tell me what brought you in today?
I have a headache. It feels like it's been forever.
When did this headache begin?
Around 10 p.m. last night.
Okay, so for about 14 hours now.
Mm-hmm.
Has it gotten better, worse, or any change over the time?
A little worse. Definitely at night. Last night it was pretty worse.
Have you ever had this type of headache before?
Nothing that lasted this long.
Where would you describe where your pain is located?
My cheek, my eyes, kind of right in here.
So around your sinuses.
Mm-hmm.
On a scale of 0 to 10, what would you rate your pain? 0 being no pain at all, and 10 being the worst pain imaginable.
Probably about a 7.
Can you describe the quality or characteristics of the pain?
Throbbing, just continuous like pressure around here.
Do you feel like pulsatile?
A little bit, not too bad.
Is there any associated symptoms with the headache? Runny nose, cough, nausea, vomiting, dizziness?
My nose has been running. I feel a little congested. Coughed a little bit, but not too much, not excessive. No nausea or vomiting or anything like that.
Is there anything that makes the pain worse or better?
I took the over-the-counter prescription Sudafed medicine. It helped a little bit, but the humidifier also helped, and it made it worse when I was outside and laying down.
Have you ever sustained a head injury or concussion?
No.
Have you experienced any dizziness with this headache?
No.
What about any neck pain? Have you had neck pain recently, swelling, or any lumps in your neck?
Woke up with a crick the other morning, but that was nothing to worry about. I've never had any lumps or anything.
Okay, so you mentioned your eyes appearing red earlier. Have you experienced any difficulty seeing spots, or blurry vision?
No, 20/20 vision, no problems with my eyes, just a little more red than normal.
Okay, well that's good. What about sensitivity to light? Are you able to tolerate this light right now, or is it making your headache worse?
The lights haven't bothered me very much. I've been okay with that.
Okay. What about your eyes? Are they watery? Are they drier than normal?
Maybe a little more watery than normal, but I've just noticed them being more red.
Okay, are they itching? Have you scratched them at all, rubbed them?
Mm-mm.
You mentioned earlier, along with your headache, that your nose has been running and you feel congested. How long have you felt this way?
About 2 days.
How would you describe the nasal drainage, like the color or consistency of it? Is it watery, pus, mucus, bloody?
I guess you could say it was watery. It's been a little bit yellow, maybe a little green at times.
Have you had any severe or frequent colds or upper respiratory infections?
No, I haven't had that in a while.
Have you experienced any trauma or blow to the nose?
The last time I did, I got hit with a softball, but nothing since then.
You didn't have any obstructions or anything from that?
No.
Do you have any nosebleeds frequently?
No, I couldn't remember the last time I had one.
Good. What about drainage down your throat? Have you felt any postnasal drip?
A little bit. Maybe it's making my throat sore a little bit, but I've just been drinking a lot of water, and but when I woke up, it was still sore a little bit.
So you have a sore throat now?
Yes.
So when did it start?
This morning when I woke up.
Have you done anything to treat the sore throat? Liquids, medicine?
Just been drinking a lot of water and stuff.
Okay. Do you still have your tonsils and adenoids?
Yes, I do.
Have you experienced any difficulty swallowing?
Mm-mm.
Have you noticed any sores or lesions in your mouth, tongue, or gums?
Nope.
Good. What about the gums? Have they bled any?
No, the only time they ever really bleed is when I'm flossing sometimes.
Okay. Thank you for sitting through all those questions. I'm just going to ask you a few more questions to get a look at the bigger picture of your health.
Okay.
Have you recently lost or gained any weight unintentionally?
No.
Do you experience any episodes of fatigue, weakness, or malaise?
No, I'm just exhausted at the end of the day when I come home. I teach and coach 3 different sports, so.
Okay, that's understandable. Do you have chills, sweats, or night sweats?
No, ma'am.
What about a skin disease like eczema or hives? Do you have that, or have you had that?
No, never have.
Okay. What about pigment change or color change in your skin?
No, the only thing, I'm losing my summer tan.
Me too. Do you lay in the sun often or use a tanning bed?
I lay in the sun. I do use sunscreen, and I haven't used a tanning bed in years.
Good. Tanning beds are not good for the skin, and I'm glad that you use the sunscreen. Have you noticed any changes in your moles, like the shape, color of them?
Nope.
What about your hair? Have you experienced any hair loss or change in the texture of your hair?
I did get an 8-inch cut lately, but no, I still have a head full.
Good. Have you noticed any changes in your nails, like the shape, color, or brittleness of them?
Nope. Pretty normal.
Do you smoke?
No, never have.
Do you drink alcoholic beverages?
On special occasions, it has been at least 6 months.
Is there anything else that you can think of that you would like to share or ask me today that is dealing with your health?
I think we've covered it all.
Well, thank you for your patience and cooperation. I hope you get to feeling better soon. The doctor will be in shortly to see you.
Thank you.